At its best, do no harm is a statement of humility. We don't know. We pretend we do. We know some things, not to make people even more apprehensive about seeing any of us. But it is a statement that your intention to help isn't good enough to just do things. But if we think about what we want out of humility and what we want out of partnership in care, another frame is, let's test ideas with caution, with professionalism. Let us open up the arena so that there is a conduit to say, what do you believe as the patient and your life experience? What have you seen with family and friends? What are you drawn to explore and experience? And with the appropriate use of do no harm, don't be cavalier, don't take unnecessary risks. Is there an entryway into exploring more personal and individual-based care? And in that way, it really is the low bar that we don't cross usually, right? We won't take chances. We're not allowed to give an opinion that's not vetted in data and study. And though there's a logic about why we want to be cautious, there's also other forms of science, other ways of knowing that would otherwise lead us into areas of care, some of which we would call integrative medicine. No one in the universe is luckier than me. Right place, right time. So family medicine in the 1980s was a forerunner of what we call integrative medicine. The concepts of what was called the biopsychosocial model, that our mind states and beliefs and attitudes and psychic experiences, psychological experiences in life are part of practice. And that we would train behind a two-way mirror with people watching us, exploring patients' consciousness and their life experiences. And that was part and parcel of care because it wasn't separate from the physical world. So the holism and the fullness of care in the first generation of family medicine was really broad. All of these ideas would then unfortunately fold into what a family doctor did, as opposed to having a team to apply different things. And this is pre-broad integrative medicine, so that you would be somewhat limited, but you were not just a physical medicine practitioner. The luck of the draw had me have a mystery illness early in my practice, in which medicine didn't have an answer. I'm one of these people who saw a ton of doctors, had a ton of tests. Nothing clarified fairly profound and limiting symptoms. And I had a physician friend who was an acupuncturist. And I said, what do you think? And I had this amazing experience. I had my first acupuncture treatment. I felt the flows. I could tell him what I thought he was doing. And it was life-changing. Another whole reality of how bodies work. But this was something that was enlivening and led me within 2 years to train as an acupuncturist. And I began to explore how acupuncture fit with standard medicine and begin to acquire from my other partners an awareness of Feldenkrais, of yoga therapies, which we offered in the old days, nutrition, and the full expanse of holistic Western medicine, now called functional medicine. And I began to grow through experience and through working with patients in a healthcare team. It was really a fellowship, what medicine could be. So what are patients looking for? And though I believe compassionate care is fundamental and often enough, where medicine is limited, where a biomedical disease model is limited, even if it includes physiology, there were some people who would thrive with an acupuncture energetic approach, or with chiropractic or touch therapies, or really in the exploration of symptoms initially from guided imagery, which was our first psychotherapy here, to the expansive psychotherapies, EMDR, tapping, all the kinds of things that are part of our practice. And without differentiation, the first visit with a patient became, what do you think health is for you? And what do you think good healthcare is for you? And then there would be an exploration of how I might enter that as a primary or as a coordinator, and how our whole service could unfold and provide for them a unique, individualized, personalized, responsible medicine that didn't differentiate. So when people say to me, what's integrative medicine? We started as a consult service, and within 10 years realized it had to be the foundation of general care as well for those people who wanted it. So we became an integrative medicine primary care and specialty consult service. And the only change that's occurred in my concept of things is that's how I envision medicine. So if you ask me what the generation that follows possibly has the opportunity for, is that freestanding in the community or in other Sutter health practices, you go to primary care and there's an acupuncturist and a chiropractor, a nutritionist, and an on-site psychotherapist doing broad-based care, and that the model of care doesn't preclude any of these as being basic medical services in a health system, because the best interpretation of do no harm is humility and wonder, right? So where I've evolved since a previous conversation is that curiosity is now a continuum of from curiosity to wonder. What the difference is for me, curiosity, and maybe people who understand the language better than me will understand it more clearly, but curiosity is an open attitude. What's changed in me is a comfort with I don't know, with a delight and joy. And because my not knowing is moved from curiosity to wonder. To say, oh my goodness, I will be your partner, you be the leader, I'll be active, but let's really make sure that we're doing this in a way that fits all your needs, including how do you want to evolve as a human in relationship to your body and your health. So in my mind, building a relationship is the only thing I care about. How that gets built has to be honorable, has to consider relative truths and possibilities. But I'm satisfied with what works. So if I have an asthmatic, right, who says, prednisone pulse, please, we're done. They know it works for them. It's all they want to do. We could engage with, they like chest unblocking acupuncture, where they like to think about related elements of allergy, diet, immune dysregulation of hollow spaces, all the things that are in the toolbox. But the truth is in what serves this, is the question of what serves this relationship at this time. Mm-hmm. So in the beginning, if you like the idea that I can have answers that are testable, maybe truth, I'm fine with, as patients often say, you can imagine that one thing people say to me is, can you just tell me what to do? I'm the kind of person who draws that out of people because that's not my first play. But yes, I can tell you what to do, as long as you'll let me know that it's not working, right? And feel like you have to go elsewhere because I'm wrong. But that we can work from a moment of, here's a relative truth, here's what fits. I'm going to tell you about your history, I'm going to tell you about your examination, I'm going to tell you about why I think this is a reasonable thing. And we don't have to go beyond that, right? A pill is easier than a supplement nutrient program. A pill is easier than lifestyle change. I'm delighted if you want to go in that area, but if you want to see what simple therapeutics offers you and you're satisfied with that, that's our workable truth, and I'm fine with that. As a young doctor, one learns that you're a professional doing a service. You're not supposed to have personal input. You're not supposed to feel, or you're not allowed to get your feelings get in the way. And there's a place, again, where do no harm, right, has a relative truth. You don't want a patient putting your feelings first. But my experience is patients want to feel seen as a human. And the only way to do that is to be a human. And so if I'm moved or touched, I'll find a way to consider expressing it. Maybe I'm not in the first 5 minutes of a visit, but maybe that's part of the healing. Maybe the higher order of our work is connectivity. Let's say the teachers of loving kindness feel like the world of love is so tainted in our society that we don't go there. So we'll call it unfettered friendliness. that I can always feel like I'm partly embodied as a friend as I am sitting along a 30-year-old as a father, or sitting along with somebody in their 70s as a soon-to-be co-70-year-old, and that I can be a partner in the universe as well as a partner in care. Mm-hmm. And that things that I find most invigorating about the day is that I care, is that I feel, is that I'm touched and I'm alive. And I'm learning about life. And if I could go back to the 22-year-old starting medical school and the 26-year-old starting practice, I would think of how I have a front row seat in the class of life, and that physicians or healthcare people are life educators, but they're co-participants in the class. And that what would have come out of my mouth before I had children, had gone through a pregnancy, and what I had learned as a family doctor, doing prenatal care, doing deliveries, taking care of children, would be so facilitated by understanding parental process. And that would have been in the room with me as it was once I started having babies and a family, and could say to people, as a parent, I feel this in a different way, so take it under the advisement. I'm not certified to tell you this, but my experience has been. And that what is enlivening and invigorating and new in practice, right? What's the new frontier as I'm not exactly winding down on a timeline, but I'm cultivating in this phase of doing this for 42 years. What are the new lessons? The new lessons are preparing for what I face, which is decline, which is potentially medical interactions with the system that I managed to avoid for the first 42 years of practice. I'm beginning to think about what lessons I learned from my patients who have, with grace and fear and trepidation and doubt, gone through, and it's in the office with me every day, and I can't turn it off anymore. And I'm thankful that I've come to a place where I can put down the pretense of knowing that which can't be known.